We look after people as they approach the terminal phase of their lives. We look after them and also their families, providing care and support. NGS are really important to us. The money that is raised through people generously opening their gardens and working really hard in their gardens is so important. It allows us to provide more care and support to people across the United Kingdom.
Macmillan is a charity which tries to look after everybody living with cancer in the UK to make sure that nobody faces cancer alone. With the amount of money which the NGS has raised for Macmillan, we've been able to fund nearly 150 nurses and other professionals. We've been able to open the Southmead Centre in Bristol, which is the NGS Macmillan Wellbeing Centre, which has got a wonderful soothing garden. And shortly we're going to be opening the NGS Macmillan Wellbeing Centre at the Royal Chesterfield Hospital.
Hospice UK is the national charity for hospices, and all the hospices, more than 220 of them in the country, are members, and we look after and support hospices and hospice care in the community. The money that we receive from NGS makes an enormous difference, and actually gardens are at the centre, the very heart of hospices. More than that, the money that we receive helps us to develop new clinical guidelines for hospices, work with carers, helps provide more bereavement support and work in communities. And it also helps us advocate for hospices.
And the Carers Trust is a UK-wide charity that supports unpaid carers. An unpaid carer is somebody who cares for maybe a family or a friend and who that person really can't do without their support. There are 7 million carers in the UK, and that number is increasing every day. And the NGS is one of our largest donors, and that money makes such a difference to people. So we're able to reach more carers and provide more support to them, giving them breaks so they can have some time away, to do other things, to meet other carers so they don't feel so lonely and isolated, and also to provide more support to them on the ground and just give them more help.
Perennial is the only UK-wide charity whose job is to help horticulturists in need, people who work in or who have retired from horticulture. We have a team of specialist caseworkers funded by the NGS throughout the country whose professional advice to people in need helps them get back on their feet. Perennial is not a huge charity, and we rely on those who love gardens and appreciate gardens for the support that we can give to people. The National Gardener Scheme funding is very, very important to us, and without it, a lot of our work would not be possible.
And the Queen's Nursing Institute actually founded the National Garden Scheme as our fundraising arm in 1927, so we've had a long and shared heritage together. The money that we receive from the NGS is hugely important to us. It means that we can support nurses to deliver best possible care in patients' homes and communities, and support their carers and their families too.
Parkinson's UK is the UK's leading Parkinson's charity, providing hands-on support and also research into the causes of Parkinson's. The partnership between National Garden Scheme and Parkinson's UK has now run for 3 years, and in that time the NGS donation has helped support local people with real local hands-on nursing support, but also increasingly over the 3 years with local advice to make sure that people with Parkinson's can really live life to the full with their Parkinson's.
The MS Society represents the 100,000 people living with MS in the UK, and we've got about 38,000 members, and those 38,000 people support the society locally, making sure that we have activities out there on a day-to-day basis to help people reach their full potential. And then we also have an extremely positive research arm which looks at finding a cure for MS, and also how we support people living now with the condition.
So Horatio's Garden is a national charity that creates and cares for beautiful gardens in NHS spinal injury centres. The wonderful thing about the National Garden Scheme is that by visiting a beautiful garden, you can be contributing to the creation of a further Horatio's Garden in a spinal injury centre. These are gardens that patients can get out to in their beds and wheelchairs, places of sanctuary for people who are spending many months in hospital after facing the devastation of spinal cord injury.
I think the important thing for people to realise is that the NGS was founded to support nursing. Our founding charity, the Queen's Nursing Institute, set up the National Garden Scheme in 1927 to raise money specifically to fund district nursing in England and Wales. And more recently, since the 1980s, we've included a number of other large national nursing caring charities amongst our beneficiaries including Marie Curie, Macmillan, Hospice UK, Carers Trust. Supporting that area of UK healthcare is absolutely our mission. That's what we're here to do, and indeed that's why our garden owners open their gardens. They feel as strongly about opening their garden to raise money for the nursing charities, as we do about organising the openings.